Well, thank you very much. And I see we have fewer people because of the virus problem. It's very important that we totally protect our Asian American community in the United States and all around the world. They're amazing people, and the spreading of the virus is not their fault in any way, shape, or form. We also have a large team working on what the next steps will be once the medical community gives a region the okay, meaning the okay to get going, to get back, let's go to work. Our country wasn't built to be shut down. At the end of the 15-day period, we'll make a decision as to which way we want to go, where we want to go, the timing, and essentially we're referring to the timing of the opening, essentially the opening of our country. FEMA is distributing 8 million N95 respirator masks and 13.3 million surgical masks across the country right now. I'm also announcing that we're postponing the deadline for compliance with real ID requirements. Earlier today, I signed an executive order invoking presidential authority under Section 4512 of the Defense Production Act to prohibit the hoarding of vital medical equipment and supplies, such as hand sanitizers, face masks, and personal protective equipment.
And so earlier today, the President signed a second executive order providing the authority to address, if it becomes necessary, hoarding that threatens the supply of those necessary health and medical resources. Persons are prohibited from accumulating those items in excess of reasonable personal or business needs, or for the purpose of selling them in excess of prevailing market prices. It is a crime to engage in prohibited activity. If you have a big supply of toilet paper in your house, this is not something you have to worry about. But if you are sitting on a warehouse with masks, surgical masks, you will be hearing a knock on your door.
The New York metro area of New Jersey, New York City, and parts of Long Island have an attack rate close to 1 in 1,000. This is 5 times what the other areas are seeing. Through the high throughput lab investigations, we're finding that 28% of the submitted specimens are positive from that area, where it's less than 8% in the rest of the country.
We've been working with the FDA to make it possible for self-collected nasal swabs, where individuals could, at the end of their nasal passage, collect a sample. And I'm pleased to report that self-collected swabs can now be collected in clinics and at drive-through testing sites. This will expedite the testing process, of course, but it will also reduce the risk to healthcare providers.
I think this is the part that we really need to take personal responsibility for. Saturday, I had a little low-grade fever. So, actually, probably a GI thing. But, you know, I'm meticulous. I'm a physician. I looked it up. I ended up piggy banking. I'm from Walter Reed, so I got a test late Saturday night, and I'm negative. I stayed home another day just
Thank you for saying that.
Yeah, just to make sure. That's how we protect one another.
So this is not retracing. This isn't anything. We've done it really well because this 2-week period has been good. And I'm not saying it ends at that time. You know, we have another 7 days or so. I'm not saying it ends at that time. But I am saying it's been like this incredible learning process. That's going to go into the future. That's going to go even as we open up our country. And we're going to be watching New York, and we're going to be watching California. We're going to be watching the state of Washington and other places. Illinois is becoming a hotspot. And we can do both. I have a question for you. So we have a lot of very angry media all around this room, and they want one of these seats. But because of social distancing, we are keeping them empty. Will there ever be a time when these seats are full, like full to the brim like it used to be, where people are almost sitting on each other's lap? And this whole row over here is packed. And now they're outside wanting to get in, and they're very jealous of all of these reporters. Will we ever have that again? Or is that something that will be, you know, it'll look like this forever?
So we're learning a lot about social distancing and respiratory diseases. And I think those are the discussions we have to have in the future. It was what you were talking about, changing our whole behavior patterns of what we touch and being conscious of that.
We have two very, very powerful alternatives that we have to take into consideration. And as I said, one of the things that has really gotten me thinking about this, number one, I'm looking at what's going on, and life is fragile and economies are fragile. But one of the things is the mortality rate, John. When we first started this, nobody knew anything about this particular virus. Very, very little. I mean, we started off, we were hearing numbers of 5%. That's an astronomical number when the flu is 0.001 and 2 and 3, right? And so 5% would be an astronomical number. Now we're seeing numbers that may be less than 1. We're building a wall. We're up to over 150 miles of wall on our southern border, which is now turning out to be even more important than we originally thought, but I always thought it was very important having borders.